I'm Cassandra Garcia. I am doing my presentation on epilepsy. What is epilepsy? Epilepsy is a neurological disorder marked by sudden recurrent episodes of sensory disturbance, loss of consciousness, or convulsions associated with abnormal electrical activity in the brain. Characteristics of epilepsy. The following characteristics have been noted on patients with epilepsy. They can experience unusual behavior, sensations, and sometimes loss of awareness. Sometimes people with epilepsy experience an aura sensation. They experience fatigue, irritability, mood swings, and anxiety. All of these go hand in hand with epilepsy. Some individuals will experience more of these or all, and some will experience only a few. In continuation of the characteristics of epilepsy, we see with aura and without. So it takes you on into the different stages of you having the seizure. So with aura, you feel like a lightheadedness or like a deja vu type of deal. Without an aura, you don't see it coming, you don't feel it coming. Then you go to the tonic phase where you start feeling a little bit of the irritability, you start feeling the sensation of just anxiety, things like that. Early clonic, that's when your brain is already having a low electricity, like a low frequency. And then the late clonic, that is the high electric sensation that we don't feel, but we don't feel it, but we do feel it because it becomes a seizure. Then early postical, that is, already getting into the seizure where you feel drowsiness. The individual, within minutes goes into the late postical, where the individual starts feeling the confusion and agitation and sleepiness. Then you go to the normal interdical, and that is already, having the seizure, and then you come out of it. Prevalence of epilepsy. According to the CDC in 2015, there is a total of 292,900 active epilepsy cases in Texas. With the minimal research that there is, the numbers have risen. They just don't know the exact number. Just because there is a lot more medication out there that controls epilepsy, and some people just don't even experience a seizure, so they go undetected, undiagnosed. The causes of epilepsy. There has been no identifiable causes of epilepsy on half of the affected people. The other half, their cause may be genetic, prenatal, injury, head trauma, and brain conditions. Age can also be a risk factor, as well as family history. Assessing and identifying epilepsy. To initially diagnose the condition, the doctor will check the patient's medical history. Doctor may perform a medical exam to check mental function and other motor abilities. Doctor may also order an EEG, electroencephalogram. In many cases, a computerized tomography, it's a CT scan, is a useful method of identification. They may order exams using an MRI, a PET scan, or a high density EEG. Instructional and curriculum strategies. When working with students with epilepsy, teachers need to consider the fact that these students might be frequently absent. Due to having epilepsy, after you come out of a seizure, you feel very fatigued. The individual has a lot of lingering symptoms. Maybe their potassium level goes low, things like that. So they do need to take a couple of days to recuperate, to get back to feeling like their normal self again. So teachers may also use the following instructional strategies to help these students achieve success. Extra time for assignments and exams, break down assignments into smaller parts, and frequent repetition of material. All of these are very useful for individuals with epilepsy because if they have small seizures in the classroom, they tend to just kind of gaze at an object. They don't necessarily have to be jerking or anything like that, but it's an absent type of seizure where they're in class, but they're not really there because they are having small seizures throughout the day, but not too drastic where they fall, fall over and things like that. Organization and support groups for epilepsy. We have Epilepsy Foundation. This is a foundation that has a local chapter here in our community. They have parent support groups as well as adult and teenage support groups. The local branch is called Epilepsy Foundation Central and South Texas, which is located in San Antonio. They have activities to involve the community for awareness and to raise funds to stop seizures, find cures, and save lives. This foundation I found to be very helpful in a lot of ways. They do have lots of support groups where, teenagers that seem like they don't fit in with their classmates because they have epilepsy, they have to be taking certain medication, they can't do certain activities in, let's say, PE, physical education. These support groups are there to help them cope with their new diagnosis, to help them to really have an outlook on their education, on their life, on their everyday skills without feeling like they are not like everybody else. Another organization that gives a good support to individuals with epilepsy is the CDC, Centers for Disease Control and Prevention. So the CDC has a Support Epilepsy Foundation hotline, which is available 24 hours a day, 7 days a week. They have trained personnel to help assist the public by answering their questions. And these questions can be from what to do with a student in a classroom. It can be from an individual who suffers from epilepsy that needs assistance in, getting out of a depression or an anxiety episode. They are also there to answer any questions from parents to loved ones, to help them understand the individual with epilepsy, help them know how to accept and to actually live with a person with epilepsy.